Hi, I'm Dr. Vivek Sukumar, Consultant Surgical Oncologist at the Specialty Surgical Oncology Hospital and Research Center. I specialize in GI oncology with a special interest in colorectal oncology. One of the most important and common questions that we get in the OPD is, how does cancer spread? So that is something that brings a lot of anxiety to cancer patients as well as their attenders. And once you detect a cancer that is spread, that is also something that the patients are very eager to know, that why it has spread or how it has spread. So today we're going to discuss in very simple words what are the common modes in which cancer can spread in the body. So let's first start with the common modalities of spread. The two most common modalities of spread is, one is haematogenous, means via the blood, and second is lymphadenitis, that is via the lymph nodes. So how does cancer spread in the blood? Any tissue to grow in the body requires blood supply. Cancer cells also are rich in blood supply. The cancer cell basically enters the blood into the blood vessels when the blood enters into the cancer tissue, and through this route it enters the body. Via this route it tends to enter the multiple organs such as the liver and the lungs, which are the common organs involved when the cancer spreads to other parts. Second common modality with which the cancer spread is the lymph nodes. If you have noticed, when you have a fever, there are tendrily glands which enlarge near your neck. Those are enlarged lymph nodes which react in response to the infection that your throat or upper respiratory tract have. Similarly, when an individual has cancer, certain types of cancers have a tendency to spread at the first point at which the lymph nodes are draining that particular site. And this is generally along the blood vessels which supply that particular organ. These lymph nodes generally enlarge and act at points at which the cancer stays once the cancer begins to spread beyond the organ at which it originates. It is important to know that these particular lymph nodes need to be removed when you perform surgery for these type of cancers to obtain optimum results. There are other modalities of spread as well, which are not very common but still can be found. So in the abdomen, we have a structure called as a peritoneum, which is basically a sac in which all the abdominal organs lie. When there is a cancer within the abdomen and it has grown larger in size, there is a tendency for this to spread inside the abdominal cavity and it gets embedded into the sac called the peritoneum. This results in fluid being accumulated inside the abdomen, and which will be rich in cancer cells, and we need to take special precautions while treating these patients, both using chemotherapy as well as extensive surgery. Similar changes are seen within the lung. The lung also has a covering called as a pleura. If there are cancers within the lung, there is a tendency for the cancer to spread inside those particular coverings called as the pleura, resulting in water accumulation which is rich in cancer cells. And thus, these particular patients who present with these symptoms also may be treated in a different manner. So these are the common modalities with which the cancer spread from one part to the other. If you have any comments to this video, please do post it in our comment box below. Thank you.